Hello, and welcome back for another episode of the Newbie Dentist Weekly Mentorship Series. I'm Dr. Omid Azami. In this week's episode, I wanted to look at the topic of communication and case acceptance, mostly through the lens of tools that we can use to communicate more effectively to our patients. During dental school, especially for those of us who graduated from Australian dental schools, our patients come through the public system and don't have to pay for any of the dental treatment that we provide as students. Now, this is good because in dental school, there's no friction for case acceptance, and we can get a lot of work done clinically for our patients without having to worry about the cost associated to those procedures, and the patients are more accepting of treatment because of that. So when you graduate and you enter private practice, and now there's that monetary factor to take into consideration on top of everything else that you have to consider when you're a new grad, it's really important to have good systems and good communication skills to be able to communicate effectively to the patient what you're seeing in their mouth and be able to talk about the risks and benefits of those procedures and ultimately get case acceptance. Because without case acceptance, you'll never build your books, and you can take all the CPD in the world and get all the skills in the world. But if you're not a good communicator and you aren't able to get case acceptance on procedures, then you won't be busy and your patients will not get the care that they deserve. So at a baseline, what I wanted to focus on today is more so the tools rather than what to say or how to say it. And the first tool that I want to talk about was the intraoral cameras. Most of the practices where you're working now will probably have these intraoral cameras. And beyond the obvious medical legal reasons for taking photos of diagnosing, during procedure, post-procedure, the intraoral camera is a very good basic tool for communicating to the patient what you're seeing. So if you see a tooth with a broken old amalgam that's cracked or leaking, you can tell the patient that this is the case, but being able to have a photographic image of that tooth and being able to show the patient that on the screen goes a long way in the patient understanding and to case acceptance. The next step up from an intraoral camera would be something like a DSLR camera. So I started with an old camera body that I had, and I bought a 100mm macro lens, and this was a game changer in my early parts of my dental career. It does take some getting used to. It does take some deliberate sort of practice, like I talked about in the previous episode, in terms of incorporating these cameras, because you gotta, prep the tooth, deglove, take a photo, put gloves back on, or put barriers on the camera, which makes it tricky. They're a little bit clunkier, a little bit heavier, and they're not really user-friendly. You gotta get comfortable with the settings and the parameters of the camera before you can get routinely good pictures. So there's a couple ways that the camera is very important. One, I used it as a part of my new patient exam. So when a new patient would come, either myself or the dental assistant would take sort of those ortho record style photos, retractors in, photos of the smile at rest, occlusal photos, buccal views. And what I then did was I would upload those photos onto the computer and I would talk the patient through the exam and what I've diagnosed based on the photos. And in particular, the arch photos I found were really useful because you can tell the patient, this is your upper teeth, this is what I'm seeing, this is what needs to be done. And the photo was a really effective tool in communicating that to the patient. And as soon as I started doing this on a routine basis, my case acceptance really went through the roof. The final addition to this puzzle, and I have to give credit to Dr. Brad Agrawal, was that I went to a talk that he did about case presentation and using technology. And one of the things that he did really effectively was using things like Keynote to annotate photos that he would take to show the patient what was possible in terms of treatment planning. So what I did was I went and bought one of these big iPads, the biggest one that was available at the time, maybe a couple of grand investment. And what I would do then is take these photos, I would put them onto the iPad, I would sit down next to the patient and we would go scroll through the photos together. The benefit of the iPad is obviously the user friendliness, the interactive nature of it. So the patient could zoom in and zoom out on certain teeth that I would say, oh, look, there's a crack there, there's some caries there, there's some recession here. And on top of that, I could take the pen and I could write down, okay, this is a tooth that needs a filling, this is a tooth that needs a crown. And I could illustrate to the patient what the treatment plan would be. And this changed everything completely. I would take these photos, and for some of the more complex cases, I would rebook the patient back another day, and I would put together a proper presentation for smile makeovers or full mouth treatment plans, and draw out and write out the prices associated for each tooth, what needed to be done, and various options that were available to the patient. They would come back, I would go through that PowerPoint presentation that I would put together on Keynote, and it was unbelievable the amount of cases and the value of the cases that I was able to sell to the patient. And as a new grad, you gotta be careful with this too, because when you get really good at the communication and case acceptance side of it, you gotta make sure you got the clinical skills to back that and be able to deliver that treatment, or else be able to refer the patient accordingly to get that treatment done. So to review, I think it's really important to take photographs. One, for obvious medical legal reasons, to have evidence of what you've done and why you've done it. Two, because it's an effective communication tool for helping patients understand what's going on in their mouth and the diagnosis that you're making. And finally, in terms of case acceptance, nothing is going to reproduce good photographs and good documentation to be able to present to the patient what you have in your mind, what you're envisioning for the patient, and be able to give them those options so they can see it clearly and accept treatment. So I hope that adds a lot of value for you guys listening. If you're not taking photographs, I really recommend to start doing it. Start with an intraoral camera or a simple point and shoot camera. A DSLR camera with a macro lens and a ring flash or a twin flash would be the next step up, and something that's a little bit more cumbersome to do, but once you get the hang of it, you get some really excellent clinical photos and the types of photos that you see on Instagram and social media being shared. And finally, I really recommend the iPad. Obviously, I'm not affiliated with iPad at all or Apple, but if you get this tool to be able to zoom in, zoom out, give the iPad to the patient so they can interact with their own photos of their mouth, it really is night and day in terms of case acceptance and a volume of work that patients will say yes to. That's all for this week. I hope you enjoyed the tips on using tools to communicate and get case acceptance. I'll see you back next week.
Thank you for tuning in for another episode of the Newbie Dentist Podcast. Please be sure to subscribe and head over to iTunes and give the show a 5-star rating. For all show notes and to access all previous episodes, head over to www.newbiedentist.com. Have a great day.